Hi, hello everyone. I am Dr. Koteshwara Prasad, Head of the Department of Orthopedics, Renova Hospital, Sanat Nagar. So here I am again in front of you guys to share another interesting topic, that is vitamin D. So a lot of people are wondering, what is this vitamin D and why should one be worried about this vitamin D? So yeah, about 15-20 years back, vitamin D was never a concern because India is such a tropical country where we all go out, we have abundant sun throughout the year. There was never a time where, we miss the sun. So, and you must be wondering, why am I talking about sun? Why I'm talking about vitamin D and why am I talking about sun? Yes, the sun and sunlight has got lot of vitamin D embedded in that, in the sense it helps in synthesizing vitamin D in human body. So sunlight is the key, and then one has to be worried about not seeing the sun for quite some time. These days when I ask my colleagues or my patients, whoever comes to the hospital, I said, when was the last time have you seen sunrise? Or when was the last time have you seen sunset? Many of them say that, no, I haven't seen in 3 months, I haven't seen in 4 months. And this is what has become everyone's life. This is our routine is. So even it happens to me. I wake up at morning 6 o'clock, and then by the time I get ready and go to hospital directly in the car, and then I finish all my work by the evening 7:30, 8 o'clock. By the time I come out, sun is gone. And where am I getting sunlight? No, I'm not getting my sunlight. So sunlight is the key for a humankind. So sun is, planetary god. So sun has a lot of importance in various cultures, and especially for human bodies. Sun is something sunlight is very, very important. So the typical signs of vitamin D, low vitamin D are polymyalgia. You will have pains everywhere. You will have pain suddenly at your back, you will have pain suddenly at your upper back, suddenly you'll have pains of muscles, suddenly you have pains in the legs. So one must be wondering, why am I having pains all over the body? And they are not fixed at one region, because each muscle works on a different times in a different way. So when there is no vitamin D, basically the muscles or the bones will start getting weaker, and then you'll start experiencing these kind of unexplained pains. Sometimes, not sometimes, most of the times what I see is all very, very young people. So it's probably starting from age 20 to, at least even, as early as 20s, and then as old as up to 50, 60. So lifestyle changes with anyone can lead to this vitamin D deficiency. So these kind of pains needs to be addressed immediately. First thing what you have to do is get a vitamin D test done, and then followed by, once the vitamin D levels are low, and then immediately you need to act. You need to act doesn't mean that, you just go out and sit in the sun one whole day and say, I'm getting enough vitamin D. That's not the way it's going to work. You have to first start on some treatment, because vitamin D, extremely low vitamin D, can be very dangerous to your health. First start with some injections, and then followed by, we'll give you some oral medication. However, I do suggest and I do urge people that, you must go on to, do some activities so that your vitamin D levels improve naturally, and then you stay healthy and you keep your bones and muscles also healthy. Thank you.